Hello everyone and welcome to today's therapeutic back massage demonstration. I am a certificate massage therapist with specialization in myofascial release techniques and spinal biomechanics. In today's session, I will observe a comprehensive back massage focusing on the primary anatomical structures that commonly develop tension and dysfunction. The patient before me is experiencing moderate trapezius hypertonicity and thoracolumbar fascial restriction, condition many of you may recognize from your own clinical practice or personal experience. As I begin, notice how I use the paravertebral musculature, paying particular attention to the erection, spine complex and the deeper multifundus fibers. The structures often harbor significant tension due to prolonged postural debilitation and repetitive mechanical stress. The techniques I will demonstrate today include advanced fascial mobilization of the thoracolumbar aponeurosis, targeted trigger point therapy for the rhomboids and revelator scapulae, specific cross-fiber friction techniques for the iliocostalis and longissimus fibers, and proprioceptive enhancement through gentle vertebral articulation. Through this demonstration, I will explain the anatomical significance of each manipulation and highlights indicator you should watch for when essential tissue response. Pay particular attention to how I modify pressure and techniques when addressing the costovertebral junction and the sensitive thoracolumbar tension zone. This therapeutic approach has proven especially effective for patients presenting with postural dysfunction syndrome, passed joint hypermobility, and chronic myofascial pain patterns, condition increasingly prevalent in your sedentary population. For health care professional watching, you will notice I integrate evidence-based techniques while respecting anatomical structures and their biomechanical relationship. For students, observe the hands positioning on body mechanics that all sustain posture without therapeutic fatigue. Let us begin with the preliminary assessment and soft tissue preparation. I will narrate each technique as we progress through this compressive back massage protocol. Remember, effective therapeutic massage requires both technical proficiency and clinical resourcing elements. I hope this demonstration will help develop in your own practice. Don't forget to subscribe.